with the doctor using their smartphone. So when they show up at the clinic, they don't have to wait. But mobile health can also be something quite sophisticated. There's now a team of ophthalmologists and engineers in Australia who are researching how to use a smartphone's camera coupled with artificial intelligence to detect glaucoma. But as promising as mobile health is, there are also challenges. One of them is regulatory issues. Healthcare is perhaps the most regulated industry in the world, and for good reason. You don't want companies selling products that are fake or even dangerous. And when it comes to health, protecting a person's privacy is essential. So the approach that many Silicon Valley companies have of, quote, move fast and break things doesn't really work in mobile health. It requires something more akin to the world of medical devices or pharmaceuticals. You might call it move deliberately and don't put people at risk. There's also resistance on the part of the healthcare system itself to using mobile health technologies. Doctors, nurses, medical technicians all have very prescribed roles, and any disruption of that often encounters resistance. And there are lots of players in the healthcare system besides the providers, like insurance companies, government agencies, hospitals, organizations like the Red Cross, and others. So to achieve real change, one has to understand how the system works and how to change it. And while ownership of mobile phones and other devices is steadily increasing, totaling now about half the world's population, it's not evenly distributed. Close to 80% of the people in Europe, the United States, and other OECD countries own a smartphone. But in other parts of the world, like India, Indonesia, Nigeria, it's much lower. But I'm an optimist. So if I were describing the state of mobile health, I'd say that the glass is half full and the water is continuing to flow in. So now let me hand it back over to Camille, who will introduce our other speakers.
Thank you so much, Eric, for this very personal and inspiring lecture. I know it's very early in your part of the state, so thank you so much for being here. So now we're going to start the pitch session. So I just wanted to remind you that if you have any questions, you can write them into the chat, as we will take 10 minutes at the end to take your questions and ask them to the speakers. So to start, I'm very happy to introduce Lucia Chocaro, who will introduce Entamar, an initiative from the Spanish Red Cross, who is using augmented reality to improve the lives of children in hospitals. So Lucia, the floor is yours.
Thank you, Camille, and thank you, Anna, again, for having us today and for giving us the floor to present our project. So I will first of all introduce myself. My name is Lucia Chocaro, as Camille said, and I'm the person responsible for international relations in the youth section of the Spanish Red Cross Youth. And today I'm going to speak a little bit about Entamar. Entamar is part of one of our biggest projects, which we will call in English something kind of hospitalized children or hospitalized animation. The app relies in augmented and virtual reality to improve the quality of the lives of both children and teenagers that are in long-term stays in hospital. This is our main goal with the project, just to make sure that we are improving the quality life of these children and teenagers. But this also contributes at the same time to make the hospital a more friendly child environment that they can help to create a sense of ownership of the space that they are living for a long time in. Our target group then goes from 0 to 17 years old. So as you can imagine, the app has different options depending on the age. I'm sure that we can all imagine that a 3-year-old is not as interested as something as 13-year-old can be. So I will show you later some of the videos of what the children see throughout the app, but it's not the same. It's not planets or not the sea. It depends on the age. But yeah, they use these apps in the hospitals throughout the project that I first referred to make sure that we meet the goal that we want to, just to make and give everyone a bit of context of what the app is about and how it became to life. It was born from volunteers in Asturias, which is where the word comes from. Entamar means to start something. So this is in fact the starting of something good, something that we want to change the reality of these children. It started in 2017. It was first done in a few trials in Asturias and Valencia. And then right now we are in 20 hospitals out of the 59 that we have the project implemented in. So that means that we are in 10 out of 17 regions in Spain, so more than halfway, but there is still room for improvement. What we do in these hospitals and what Tesco's helps with the finding is that we have a kit. The kit is consisted of 3 tablets, 1 computer, 1 modem, Wi-Fi, so that they don't have to rely on the Wi-Fi in the hospital. And then the app that everyone can use throughout tablets or smartphones has 3 different modes, as I said before. One is decorating your own room, escape rooms, and trivial modes. And as I said, these initiatives comes from the volunteers. So the good thing that it uses augmented reality is that it can always be changed. So the volunteers can create their own escape rooms, their own trivial modes. It sometimes goes about gender equality and another is about how to recycle. So I will show you the screen so that you can see what I'm talking about in real life. So I'm guessing everyone can see right now. I see some nodding, so yeah. So this is the main poster that we will use. This is one of our volunteers in one of the rooms. This is one of the options, the planet ones that the kids can use in the room, just to fake that they're in the space. This is one of the trivial modes. So they see a small volunteer in a Red Cross t-shirt. These are some kids playing with it, and these are the tablets, for example. I will now move so that you can see a bit of how this means in real life. So that's one of the rooms, and that will be the planets pumping up in reality. The good thing is, as I said, the volunteers can create their own images, but also the kids, so that they can do their own drawings and decorate their own room. And this is the other option, to have the sea, so that they can fake that they are in the ocean and having birds around their heads and just think for a moment that they're not in a hospital, and making sure that they feel that their environment is also their own. So yeah, this is in a nutshell what would be Entamar for us and what we are hoping to aim. So back to you, Camille.
Wow, thanks a lot, Lucia, for this very impressive initiative. A little piece of my heart is in this project because I have the opportunity to be involved in the pilot test, and I think that is really grateful to see that now it's running in different hospitals. And now with this nice presentation of Lucia, let's now move to Mexico to discover Unima, a social enterprise that created simple tuberculosis diagnosis test requiring only a smartphone. Laura, the floor is yours. Please go ahead.
Thank you so much. Can you hear me?
Yes.
Yes, perfect. So I'm going to use my presentation from the beginning. Can you see my screen?
Not yet. Now.
Okay, perfect. And okay, perfect. So I'm going to thank you so much, Anna. I'm going to introduce you to Unima. We are a biotechnology company based in Mexico, and we develop fast and low-cost diagnostics for being able to provide access to a timely diagnostic for 3 billion people living in the developing world or in low-resource settings. Also, we are developing these solutions not only for the global health market, but we also want to provide them for agriculture, environmental solutions, and other markets that can be available to the detection of a certain molecule. So we are taking diagnostics out of the lab and giving the power back to the people that are working nearer to the people. so that they can have access to these tools. So what we have found is that today we can actually diagnose almost anything. And the problem is that we need centralized labs to achieve this. These have high costs. They require highly technical and skilled personnel to achieve the results, and may take hours or even days to give a result back. So they are no longer actionable, and they become irrelevant to the people while also being expensive. So what we have designed is a solution that we call Find, and we are looking that these are easy to use, that they require minimal training, that almost anyone with very little technical training can help diagnose a person. For example, a community health worker can do that for a person, that they are fast, that they can provide a result in as little as 5 minutes, and that they are also affordable, so that this can really be used by a lot of people around the globe for very common diseases that are out there. So what is our technology based on? Our technology has 3 pillars. The first one is a shark antibody that is developed that can be changed to detect different biomarkers detected in blood, saliva, urine, or other bodily fluids. Then there is a surface where you can fixate this shark antibody that has been modified. It can be plastic, it can be paper. And finally, when in contact with the blood or the urine or the sample, it creates a visual result. Finally, the third component would be a smartphone application that has been programmed with neural network algorithms and machine learning to make the image analysis. And this will provide a very accurate result to whether the sample is positive or negative to a certain disease. In this case, tuberculosis or coronavirus, which are our 2 products that are fully developed. Also, I just went to the, that's, so what our smartphone application does, it takes the photograph and it uploads it to the cloud server, where we can create in real time an image, a map, a thermal map in real time that gives us information of how a disease is developing around the world. So this can give us information if there's an outbreak of a disease in a certain area, and also the demographics. And it can give governments and international health organizations enough information to be able to create the strategies to control that disease outbreaks around the world. I think I mentioned that also the 2 fully developed products that we have already done are for tuberculosis through an antibody blood test and a saliva test for coronavirus. So these are our 2 products right now. And thank you so much for listening. This was my presentation.
Thank you. Gracias, Laura. It's so interesting. Very, very inspiring project. Thank you.
Thank you, guys.
Yeah, and now we're going to France and to listen to Sama Galusi, who is the founder of Aliatech, which is a social enterprise that was also part of the social entrepreneurship program of 21, the social innovation accelerator of the French Red Cross. So we're very happy to have you here to introduce the medical voice assistant Aliatech. Sama, the floor is yours.
Okay, thank you. So I will start with sharing the presentation. Everybody can see the presentation?
Yes, we can.
Okay, great. Okay, so hi everybody, I'm Sama, founder of Aliatech, and I would like to start with a personal story. During my study as an engineer in information technology for health, I had several internships to do in the hospital environment. And one of the internships I did was in the anesthesia intensive care unit of the Grenoble University Hospital. And during my first day of training, I went to the recovery room, and there a nurse came to me because one of the patients of this service who had just woken up after her operation could not communicate with the medical team. She was an elderly woman who spoke only in Arabic, and they asked me to translate what she was saying. But since I don't really understand Arabic, I couldn't help them, and it was quite frustrating. In France, 2 million people do not speak French. And we have observed that patients who don't speak the same language than the caregiver will have difficulties in receiving proper care. First, because communications problem will have an impact on the quality of care, and also the language barrier can have direct consequences on the patient's care, which results in a higher risk of medical error and omission, an increase in the number of hospitalization and analysis, and also high cost of professional interpreters. So our innovation consists in digitalizing interpretation by gathering in a single tool the medical knowledge of several languages and dialects. And this is AliaTalk, the medical voice assistant. So I hope the video will work. If it doesn't, I have a backup. I will try the backup. Okay. Problem with the backup. I will try another. I will. Okay, I will share. Do you see my screen?
Yes, we do.
Okay. Pourquoi êtes-vous venu aux urgences?
Why have you come to the ER?
I got hurt at work.
Je me suis blessée au travail.
Où est-ce que vous avez mal?
Where does it hurt?
I hurt my leg.
Je me suis fait mal à la jambe.
Sur une échelle de 1 à 10, où situez-vous la douleur?
Can you assess your pain between 0 and 10?
8.
8.
So now I'm going back to the slide. So do you see the slides?
Yes, we do.
Great. Okay. So today, our solution is capable of translating the most common medical phrases into the patient's native language, taking into account the patient's medical and cultural context. Our service is available on smartphones thanks to an application that interprets in real time the conversation between a practitioner and a patient that don't speak the same language. And for that, we use new technologies to serve the common good. Thank you.
Thanks a lot, Sama, for this great presentation. Yeah, it's really nice to know this kind of solutions from the first hand. When you identify a clear necessity, it's really easier and you involve yourself in the development of some solution. And to close to this pitch session, we are going to leave some time at the end to answer some questions. Laura, I think that you have some of them. You can prepare the answer for the end. And I am happy to introduce the last solution and Will Butler, Chief Experience Officer at Be My Eyes, a Danish social enterprise that improves the daily lives of visual impaired people. Will, go ahead.
Hi, Thank you so much. It's great to be here. What incredible solutions. I'm like kind of nervous to follow all those three, but I'll do my best. So close your eyes for just a moment. If you couldn't see, how would you manage your health? Right? You need to, almost everything we do to take care of our bodies and to make sure that we're living healthily involves reading some instruction or interpreting some data or assessing a problem visually. You can open them again. There's as few as 285 million people in the world who have a moderate to severe visual impairment, and as many as 2.2 billion people who are living with some type of visual impairment, whether it's just a lack of access to glasses or something chronic. So this existence of visual impairment is not actually what I would call the problem. Visual impairment is a very, very normal part of every human's life. The longer you live, the more likely you are to encounter one. The problem is that the world's information is not delivered in a way that is accessible to everyone. It's a design problem. And whether it's the small print on a pill bottle or more complex information like the results of a home pregnancy test, our medical information, our health information is not being delivered in a way that is accessible to the hundreds of millions of people who are unable to see those indicators. So how do you solve such a massive problem? Some statistics show that as much as 98% of the internet's most popular homepages have basic accessibility problems that prevent people from accessing them with their screen readers. People like me who use assistive technology to access information quite easily if it's designed in a way that's accessible. But you've got this widespread issue of awareness being low, of designers not knowing how to do it correctly. And it's very daunting when you think about it at scale, about how are we going to solve this problem for the world's visually impaired population. So at Be My Eyes, we think we have a solution. I'll tell you in just a second exactly how it works, but first I'll take you back to the founder of Be My Eyes and how he came up with this idea. So back in 2015, this gentleman named Hans in Denmark was losing his own vision. And he spent a lot of time volunteering in the homes of people who had visual impairments. And they kept saying the same thing. If I just had a pair of eyes in my pocket once or twice a day, I think I'd be okay. I think I would be able to handle this change in my vision. And so he thought, what if we combine this brand new technology of video conferencing, of Skype and FaceTime and the ability to make a video call on your phone, and we combined it with the general kindness of strangers. He knew that when you step out onto the street, people will help someone with a white cane or a guide dog. And so he thought, what if we combine these two things into one? So in January of 2015, we launched Be My Eyes, which essentially just asked anyone in the world if they'd like to volunteer to be the eyes of someone who needs them. And we had no idea whether or not this solution would take effect, but immediately people started signing up. And so this showed us something that there was not only a need, this large need for the hundreds of millions of visually impaired people, but there was a need amongst others in the world to volunteer to help, but they had to be given a simple way to help. So fast forward to today, we've amassed a volunteer network of almost 6 million individuals around the world who are volunteering to be the eyes of visually impaired people in about 185 languages. And these people are volunteering 24 hours a day, 7 days a week, and they're answering smartphone calls at their own convenience when a blind or visually impaired person needs help, they simply can tell their phone to open the Be My Eyes app and press this big blue button. And within just a few seconds, it's initiating a video call. And someone on the other end is going to pick up in the same exact language that the user speaks and talk them through whatever visual problem it is. So how does this apply to health? Today, we're initiating partnerships with health organizations that include pharmacies, they include government agencies. The National Health Service of the United Kingdom just announced that they're going to be using Be My Eyes to assist with lateral flow tests and home COVID testing in the UK. But we're just getting started. Our volunteer network can host support for the blind with general tasks. But we have this massive volume of specialized tasks, from technical support to medical support, that need an expert pair of eyes to look at. And that's the phase that we're at now. But luckily, it's also the business model that propels this forward, so that we never have to pass the cost of using the app on to the user. Today, we have about 400,000 blind and visually impaired users around the world, which sounds like a big number, and it is for our community, but it only represents about 0.1% of the total possible users of this application. So we have a big job to do to spread the word that blind and visually impaired people can get a pair of eyes anytime they need it through our app, whether it's a smartphone from iOS or Android. And we're hoping that anyone here who's listening today can help us along in our journey. I'm happy to answer any questions later on too. And thank you all so much for having me. I'm really honored to be here.
Wow, thank you so much, Will. A very, very clear pitch and impressive figures. Thank you so much. So now we're going to start the Q&A sessions. We saw a few questions in the chat. I think the first one was for Unima, for Laura. So how did you define your markets when you initially started? How many patients and how much did you estimate? How much funding you needed?
So at the beginning, we were, okay, so our business model has changed. We started with tuberculosis, and we started thinking of this solution for the number one killer infectious disease that was respiratory at the time, which was tuberculosis. And we just thought that a solution needed to be made. So the market was huge, and that's how we just started. We used the approach of build it and they will come. And that's how we started our tuberculosis test. I don't know if that answers the question. Right now it's a little bit different. Right now we go to large organizations and ask for specific needs that they have, and then we develop a solution around that.
Thank you so much, Laura. I think we have another question.
Yeah, there's another question. I think that is from Laetitia. I think that is related with the project from Aliatet. Could you explain how do you manage confidentiality, data protection of the content from the application?
Okay, yes, I saw the question. I was responding by writing. So how we do for the moment, today the application is made for practitioner. So we don't know the patient that is with him during the conversation. So this is how we do to be sure that we don't have any patient information in our database, is that all the information that we have is the question that the practitioner will ask to the patient, and we don't have the name of the patient of this or something that can de-anonymize their information. So I hope I responded to the question. So this is how we do it today, and so we don't need information from the patient.
Thanks a lot, Sama. I am going to get one moment the word just to following the Will proposal about how the volunteers work around the Be My Eyes project. I have to thanks our amazing translators. They are volunteers also, and they are working for us, such as with their own time. And there are another question for Will. It's related with that I might have missed, but what is the business model behind applications like Be My Eyes that is offered for free? Do you have any support? Do you pay something from the developers? If you can give us a little ideas around that, it's going to be helpful.
Absolutely. This is a question that we didn't have an answer to for many years because as a company with a blind founder, we were determined never to charge for the product. So we spent about 3 years trying to figure it out. And then we realized people were using Be My Eyes and volunteers in our app to solve use cases that were problems that were created by companies. For instance, to fix your computer. So we went straight to the companies, such as Microsoft, and said, would you like to come on to Be My Eyes and assist with these specialized use cases? And they said, absolutely, we have disability support at Microsoft. We would love to help. And we said, is this something that you would pay a fee for? They said, yes. Microsoft became our first customer. So the model is that companies join the platform, whether it's to provide specialized help, to join as a corporate volunteering program so that they may have a volunteering opportunity at work, or to provide an internal video support at work. We have a range of 3 solutions that companies can partner with us on. And that's what funds the volunteer network, which remains entirely free and unlimited.
Thank you so much, Will. We have another question for Eric this time. So is there any support and funding from investment community for social problem solvers like all these apps?
I think the short answer is yes. It really varies depending on the app. I think for an app like Unima, it seems like that is a business that could actually just on first glance, scale up and turn a profit. And so you might find a wide variety of investors willing to invest in something like that. For other applications where the market might not be so big or the profits might not be big, there is a growing group of impact investors and philanthropists who are willing to invest money in companies that are building these sorts of things, not with the expectation they're going to make a lot of money off of it, but maybe that they'll make a little bit or break even, or in the case of philanthropists, even that they'll not make money, but that the mission is so important and the app is so important that they're willing to do it. But the impact investing market is one that's really been growing quite a bit. So I'd say the answer is yes.
Loha, you have your hands up. Thank you.
Yes. I think I did not answer half of the question that was asked to me a little while ago. Just to give you an example, yes, Eric is correct. We have received actually funding from Silicon Valley, from other places as well, but Silicon Valley too, because we are the first YC Mexican company, Y Combinator. That's a huge accelerator in the US. And we have received in total about $2.5 million from several investors. So yes, and the expectation is for this to grow and to scale up in a way that it's actually that it's so big that yes, the investment will be. They will not get a small amount back. They would actually get a lot of money. People could become rich, and this is a company for global health. So that could be very good news for this sector.
Thank you so much, Laura, and thank you, everyone. I can see that there are other questions that we didn't answer yet, but we want to fit into the timing. So I would like to thank you all. If you want to have the contact details of the speakers, please reach out to us and we will put you in touch so you can keep the discussion, and we will send you a recap of this meeting this week. So thank you again to all our speakers and to everyone, and most of all to our translators. And we see you for our next 45 minutes event.
Thanks a lot. Ciao.
Thank
Gracias.
you so much.
Muchas gracias.
Yes.
Really pleasure to come with you. Ciao.
Ciao.
Bye.
Adios.